Have you ever woken up feeling off, but brushed it off like nothing? Not dizzy enough to call it a problem, not tired enough to stay in bed, just not quite right. Maybe your balance was a little off, maybe your heart beats a little faster than usual, or maybe for a moment you forgot what day it was. If you're over 60, I need to tell you something. That moment might not be just age. It might be your brain's early whisper for help. And ignoring it could cost you everything you love. Hi, I'm Dr. Paul Emerson. I've spent over 30 years helping older adults stay independent, sharp, and mobile. And I can tell you this, stroke rarely comes out of nowhere. It builds quietly from tiny signals and from small habits we repeat every morning without even thinking. Today we're going to walk through 7 morning traps, habits that seem normal, even healthy, but could be quietly weakening your brain and your muscles. We'll talk about circulation, hydration, salt, and how one missed glass of water could make the difference between walking freely and needing a walker. So, I'd like to ask you, have you ever woken up feeling dizzy, shaky, or just off and didn't know why? Leave me a number 1 in the comments if that sounds like you, or a 0 if you've never experienced it. I read every comment myself, and your story might help someone else recognize the danger signs. If any part of this message speaks to you, please subscribe to Dr. Brain. This is a safe, supportive space where we help you protect your brain before it needs saving. Let's begin. Number 1, waking up gently. Why 2 minutes can save your brain. Can I ask you something personal? How do you usually get out of bed in the morning? Do you sit up slowly, stretch, and take a breath? Or do you pop up quickly, feet hitting the floor in seconds? Most people, especially men, will say, I just get up and go. What's the big deal? Here's the big deal. If you're over 60, standing up too fast in the morning might quietly be putting your brain at risk. Let me explain why. After 7 or 8 hours of lying down, your blood flow slows, especially to your brain. Your heart rate drops, your blood pressure lowers, and your body goes into a deep state of rest. Now imagine this. You suddenly go from lying flat to standing tall, like flipping a switch. That quick shift can cause your blood pressure to drop even further. It's called orthostatic hypotension. And according to the National Institute on Aging, it affects about 30% of older adults. That sudden drop in pressure means your brain might not get enough oxygen, even for just a few seconds. You might feel dizzy, a little lightheaded, or like you need to steady yourself on the wall. Sound familiar? The real danger? Those few seconds can trigger a mini stroke in someone already dealing with poor circulation or weak arteries. I've seen it in my own practice by patients who say, I just felt dizzy for a minute, then I was fine. But a brain scan tells a different story. Tiny, silent damage. Over time, that adds up. But here's the good news. This entire risk can be avoided in under 2 minutes. When you wake up tomorrow, try this. Before you sit up, take 3 slow, deep breaths. Wiggle your fingers and toes. Let your blood start moving again. Then sit up and place your feet flat on the floor. Pause, wait 15 to 30 seconds. Then stand slowly. That's it. No pills, no machines, just presence and patience. Your brain needs a gentle wake up, not a jolt. Have you ever felt dizzy in the morning when standing? Drop a comment below. I'd love to know how often it happens and what you do about it. Your insight might be the exact encouragement someone else needs. Because sometimes the strongest thing you can do is slow down. And now, let's talk about what your brain is truly craving the moment you wake up, and why ignoring it could silently damage your circulation. Number 2, first glass of water, your brain's morning fuel. Let me ask you something simple. What's the first thing you drink after waking up? Is it coffee, a glass of juice, or maybe nothing at all? If you're like most older adults I see in my clinic, chances are water is not your first choice. And that's exactly where the problem begins. See, while you sleep for 6, 7, maybe even 8 hours, your body continues to lose water through breathing, through sweating, even through tiny movements you make during the night. And yet, you're not drinking anything. So by the time you open your eyes in the morning, your brain is already dehydrated. Now, here's why that matters. Your brain is made of roughly 75% water. It doesn't store water. It needs a constant supply to function. And when that supply drops, even just a little, your blood thickens, your circulation slows, and your risk of stroke goes up. In fact, Harvard Health Publishing reports that even mild dehydration in seniors can lead to confusion, fatigue, memory lapses, and delayed reaction times. In more serious cases, it raises blood pressure and reduces oxygen delivery to the brain. The perfect storm for stroke. But there's more. Many seniors take medications like diuretics, water pills for blood pressure or heart issues. These meds make you lose even more fluids at night without you realizing it. So when you skip water in the morning, you're not starting from zero. You're starting from behind. It's like trying to drive a car without enough oil in the engine. You might get going, but not without strain and wear. The fix? It's simple. Drink 1 full glass of room temperature water before anything else. That means before your coffee, before breakfast, before your pills. If you take medication in the morning, water helps your body absorb it properly. If you drink coffee, water helps protect your stomach lining and blood pressure. And for your brain, water is like fresh fuel, clearing the fog and helping restore circulation. This small habit, it takes less than 1 minute, but it might just add years of mental clarity. Do you already drink water first thing in the morning? Or is this something you'd like to try starting tomorrow? Let me know in the comments. And if you have a reminder trick that helps, share it. Your simple habit could help someone else protect their brain one morning at a time. Now, let's take a look at something else that often sneaks into our morning and may be silently damaging your brain through a different culprit. Salt. Number 3, the hidden salt in your breakfast and how it attacks your brain. Let's talk about breakfast, the most important meal of the day, or at least that's what we've been told. But for people over 60, breakfast can also be the most dangerous meal if you're not paying attention to one hidden ingredient, salt. And I'm not talking about the salt shaker. I'm talking about the kind you don't taste, the kind that hides in so-called healthy foods, the kind that stiffens your blood vessels and raises your brain's pressure before you've even finished your first bite. Let me walk you through this. A typical American breakfast might include a slice of toast with butter, a bowl of instant oatmeal, a sausage patty, or maybe a breakfast bar that says low fat on the label. Seems innocent, right? But here's what most people don't realize. That one sausage patty, it may contain over 500 milligrams of sodium. That packet of flavored oatmeal, another 250 to 300 milligrams. Even one slice of whole wheat toast can pack 150 milligrams, and that's without the butter. By the time you finish breakfast, you've already consumed over 1,000 milligrams of sodium. And the American Heart Association recommends no more than 500 milligrams per day for adults over 60. That means you're hitting 2/3 of your daily limit before 9 a.m. Now, why does that matter? Because in the early morning, your body naturally has a cortisol surge. This stress hormone raises your blood pressure. Add excess sodium on top of that, and your delicate brain capillaries take a hit every morning. Over time, that pressure stiffens arteries, increases the risk of stroke, and silently wears away your cognitive sharpness. I've had patients come in saying, but I never add salt to anything, doc. And I believe them, but they're still getting too much, just from the hidden salt in processed breakfast foods. Here's the good news. You don't need to give up breakfast. You just need to make smarter swaps. Try plain oats with berries instead of flavored packets. Go for boiled eggs and avocado instead of sausages and cheese. Look for breakfast bars with less than 140 milligrams of sodium per serving. That's considered low sodium by FDA standards. And most importantly, start reading labels. If it's in a box, a pouch, or a wrapper, check the numbers, because this isn't about diet. It's about protecting your brain before it needs saving. Have you ever checked how much salt is in your breakfast? Let me know in the comments. And if you've made any smart breakfast swaps lately, please share. You might just help someone else take the first step toward a sharper, healthier brain. Now, let's turn to another breakfast habit that many rely on. One that feels comforting, but can quietly spike your blood pressure if you're not careful. Coffee on an empty stomach. Number 4, coffee on an empty stomach. A comforting habit with hidden risks. Now, let's talk about something sacred to many of us. Coffee. That warm, familiar cup. The aroma that wakes you before your eyes are even open. And it's comforting. It's part of your identity. And for a lot of people over 60, it feels like the only way to get going. But here's a question I ask every patient who drinks coffee first thing in the morning. Are you drinking it before or after breakfast? Because the timing, and especially if your stomach is empty, could quietly be hurting your brain. Let's break it down. When you drink coffee on an empty stomach, several things happen. Your cortisol levels spike. Your heart rate increases. Your blood vessels constrict. Your stomach acid rises. And your blood pressure, often already high in older adults, can surge. This reaction is even more intense for people over 60. As we age, our arteries become less flexible. Our nervous system is more sensitive to caffeine, and our tolerance for sudden changes, like adrenaline surges, goes down. The result? That comforting cup of coffee can lead to morning dizziness, irregular heartbeat, anxiety, acid reflux, and over time, increased risk for stroke and memory issues. According to a study published in the American Journal of Clinical Nutrition, caffeine on an empty stomach can raise systolic blood pressure by as much as 8 to 10 millimeters of mercury within 30 minutes, especially in adults over 60. Now, am I telling you to give up coffee? Absolutely not. Coffee, in moderation, has some cognitive benefits. It can boost alertness, even lower the risk of Parkinson's and Alzheimer's when used correctly. The key word is correctly. So here's a better way to enjoy your morning coffee without hurting your brain. Start with a glass of water. You're waking up dehydrated. Water protects your blood vessels and balances caffeine's effects. Eat something small first. A boiled egg. A slice of whole grain toast. Even a few almonds. Food buffers the caffeine and reduces its impact on your heart and nervous system. Limit it to 1 cup, not a giant mug, not 3 in a row, just 1 moderate cup. And watch the sugar and creamer. 1 tablespoon of flavored creamer can contain up to 5 grams of added sugar. That's more than a teaspoon. Every drop matters. What's your coffee routine these days? Do you drink it before eating? Or have you found a balance that works for you? Let me know in the comments. And if you've made a change, like moving your coffee after breakfast, share what difference you felt. Your habit could quietly inspire someone else to make a safer, smarter shift. Now, speaking of quiet warning signs, let's talk about the symptoms your brain might whisper in the morning and why brushing them off could cost you more than just a few minutes of balance. Number 5, morning symptoms you should never ignore. What your brain might be trying to say. Let me ask you something personal. Have you ever woken up and felt just off? Not sick, not in pain, just not quite right? Maybe your balance was a little shaky. Maybe your arm felt weak for a few minutes. Maybe your speech wasn't as clear. and maybe you shrugged it off thinking, I probably just slept funny. But what if your brain was trying to tell you something? See, these subtle symptoms, dizziness, weakness, slight slurring, they aren't always harmless, especially if you're over 60. In fact, they could be early signs of something called a transient ischemic attack, or TIA, also known as a mini stroke. A TIA happens when blood flow to part of your brain is blocked, but only for a few minutes. The symptoms come and go, which makes them easy to ignore. But here's the truth. According to the National Stroke Association, about 1 in 3 people who have a TIA will go on to have a full-blown stroke, often within a year, sometimes within days. And these mini strokes, they happen most often in the early morning, right when your body is making the shift from sleep to wakefulness. That's when blood pressure spikes. That's when circulation is still sluggish. That's when the brain is most vulnerable. Now I get it. We all forget words sometimes. We all feel a little tired some mornings. But if your symptoms are sudden, unusual, or only on one side of your body, then that's not just aging. That's your brain waving a red flag. And here's what I want you to do. Don't ignore it. Write it down. Even if it goes away in 5 minutes, note the time, what you felt, which part of your body was affected. There are even simple apps like Stroke Alert or NeuroTrack that can help you track symptoms and share them with your doctor, because the brain doesn't always shout. Sometimes it whispers, and we have to learn how to listen. Have you ever had one of those mornings? A moment that felt off, but you pushed through anyway? Tell me about it in the comments. Your story might help someone else realize. Those small signs can carry big warnings. Now, let's shift to something very practical and often overlooked: how and when you take your morning medications, because even the best pills can fail if taken the wrong way. Number 6, morning medications, the right way to protect your brain. Let me ask you this. How confident are you when it comes to your morning medications? Do you take them at the same time each day? With water? With food if needed? Or do you sometimes forget, guess, or double up just in case? If so, you're not alone. Medication confusion is one of the most common and quietest risks I see in patients over 60. And sadly, it's one of the most preventable. Let me explain why it matters, especially for your brain. Many of the pills you take every morning do more than manage symptoms. They act as your brain's daily shield, especially medications like blood pressure pills, blood thinners, cholesterol medications, memory support, or mood stabilizers. When taken the right way, these medications improve blood flow, reduce clot risk, and help protect the fragile vessels inside your brain. But taken the wrong way, let's look at just a few common mistakes. Skipping a dose. You may feel fine that day, but your blood pressure could spike without you noticing. That spike puts silent stress on your brain. Doubling a dose. Maybe you weren't sure if you already took it, so you take another. That can cause blood pressure to drop too low or increase bleeding risk. Taking meds with coffee instead of water. That interferes with how your body absorbs the medicine and can lead to side effects. Swallowing pills on an empty stomach that are meant to be taken with food, that reduces their effectiveness and irritates your gut. I've seen stroke patients end up in the ER simply because they mixed up their meds or forgot just one important dose. But there's good news. Fixing this doesn't take a new prescription. It just takes a new system. Here's what I recommend after 30 years of helping seniors. Use a pill organizer, one with compartments for morning, afternoon, and evening. Set it up once a week. It removes the guesswork. Pair your pills with the daily habit. Keep them near your toothbrush or beside the coffee pot, as long as you drink water with them first. When something becomes part of a rhythm, it sticks. Set a reminder on your phone or smart speaker. Let technology take the pressure off your memory. Never change your dose without talking to your doctor, even if you feel fine. Some medications work silently. You don't feel the benefit, but your brain does. What's your system for staying on track with your medications? Do you have a trick or a routine that's helped you? Share it in the comments, because what works for you might be exactly what someone else needs to stay safe. Now, let's take one final look at something we all do, but often delay first thing in the morning: going to the bathroom. And why holding it in, even for a few minutes, might be putting hidden pressure on your heart and brain. Number 7, the morning bathroom trip. Why holding it in could harm your heart and brain. Let's talk about something we all do. Something so basic, so routine that we barely think about it until it becomes urgent. That first bathroom trip in the morning. Now let me ask you, have you ever woken up, felt the urge to go, but stayed in bed anyway? Maybe you scrolled your phone. I checked the weather. Waited for the coffee to brew. It seems harmless, right? But for people over 60, delaying that first trip to the bathroom can quietly put stress on your body, and especially your heart and brain. Here's why. While you sleep, your kidneys keep working. Urine builds up in your bladder throughout the night. By morning, it's full. When you ignore the urge and hold it in, your body doesn't just wait patiently. Instead, it triggers a subtle stress response. Hormones like adrenaline and cortisol get released. These hormones increase your blood pressure. They constrict your blood vessels, and they place sudden tension on your cardiovascular system. Now, combine that with a full bladder pressing on your diaphragm, and you've got pressure rising from all angles, exactly when your body is trying to ease into the day. And here's what concerns me most. For people with a history of high blood pressure, heart rhythm issues, or atherosclerosis, this early morning pressure can trigger irregular heartbeat, elevated stroke risk, even fainting or mini strokes in vulnerable individuals. According to a study published in the Journal of Urology, delayed urination in older adults was associated with significantly higher systolic blood pressure readings, especially in the morning. And yet, the solution is as simple as listening to your body. So tomorrow morning, when you feel the urge, don't wait. Don't scroll. Don't delay. Just go. Think of it as your first act of self-care each day. It doesn't take long, but it lowers your internal pressure, protects your heart, and helps your brain start the day with the balance it needs. Have you ever made a habit of holding it in when you wake up? Or have you noticed feeling a little off on days when you delayed that first bathroom trip? Share your experience in the comments. You never know. Your story might help someone else take this tiny but powerful step toward better brain health. Now that we've gone through all 7 of these quiet but critical morning habits, let's step back and look at the bigger picture. Because stroke prevention and brain protection isn't about doing one big thing. It's about doing small, intentional things consistently. You've just walked with me through 7 quiet morning habits. Habits that seem harmless, habits that feel automatic, but habits that, over time, can wear down the very thing that keeps you independent, your brain. From jumping out of bed too quickly, to skip water, to holding in that first bathroom trip, each small moment is like a tiny weight pressing on your brain's ability to function, focus, and stay sharp. But here's what I want you to remember. You don't need to fix everything overnight. Start with one change, just one. Sit up slowly, drink water before your coffee, or check your sodium on tomorrow's breakfast label. These are not small acts. They are signals to your brain that say, I care about you, I'm paying attention now. Because the truth is, stroke rarely comes out of nowhere. It builds quietly. Habit by habit, morning by morning. But so does healing, so does protection, so does strength when it's chosen one moment at a time. Which habit surprised you the most today? Was it the salt in your toast, the dizziness you've brushed off, or maybe the way coffee affects your blood vessels? Leave me a comment below. Your story could remind someone that they're not alone and that it's not too late to change. And if you found this video helpful, please share it with someone over 60 you care about, because knowledge, especially when it comes to stroke awareness, is only powerful when we pass it on. Now, before we go, let me ask you one last question. Have you ever taken a multivitamin at night, thinking it would help you sleep or boost your health? Because there's one specific vitamin found in many brain-boosting supplements that could actually raise your risk of stroke overnight. I know that sounds shocking, but the science is real. And the mistake is common, so in our next video, we'll break down the surprising truth behind this vitamin, how it affects your blood vessels, your sleep, and your stroke risk while you rest. Click here to watch This Vitamin Raises Stroke Risk Overnight. You don't want to miss it. And remember, your mornings matter, and so does your health. Protect your brain before it needs saving.